Hello, my name is Cheyanne Dierickx, and I am currently a graduate student at the University of Illinois. Today we are going to talk about alcohol use among Illinois farmers and what we know and how to help. First, I would like to thank the North Central Farm and Ranch Stress Assistance Center, as well as the University of Illinois Department of Agricultural and Biological Engineering for making this possible. So, to begin, it's important to know that farmers face a variety of stressors in their daily lives, such as time pressures, workplace hazards, extreme weather events, and market instability, just to name a few. This is of concern because chronic stress can lead to various negative mental and physical health outcomes, including substance use. And currently, there is not a lot of research concerning substance use in farming populations. Therefore, we conducted a survey to examine mental and physical health and substance use in farmers in Illinois. The goal of this presentation is to highlight alcohol use among Illinois farmers, as well as provide resources for farmers and their families who may be concerned about their alcohol use. So, how was this research conducted? Well, we sent a mailed questionnaire to randomly selected farmers in Illinois. The questionnaire included various topics, including mental health, substance use, and farming experiences. For mental health, the survey contained questions from various mental health assessment tools, but today we're going to focus on depression and anxiety, which were measured using the PHQ-9 and the GAD-7 respectively. For substance use questions, we used the Brief Assist to examine past 3-month and lifetime use of the following substances, but today we are going to mainly focus on alcohol use and a little bit of tobacco use. As for farming experiences, we asked a variety of different questions, but today we are going to highlight how alcohol use is related to certain farm-specific stressors. So, what did we find from the results of the survey? What do we know? First of all, 3 in 4 Illinois farmers have used alcohol within the past 3 months. This is of concern because that is higher than the general population, with around 54% having consumed in the past month and around 68% consuming in the past year. As for what we found for farm-specific stressors, we found that farmers who consumed alcohol were more concerned about workplace hazards, time pressures, and weather. Therefore, they may be using alcohol as a way to cope with these stressors, although further research is needed in that area to know for sure. As for polysubstance use, or in other words, the use of more than one substance, we found that a little more than 1 in 5 Illinois farmers reported both tobacco and alcohol use recently. Of those, around 20% met the criteria for depression, and approximately 23% met the criteria for anxiety. With that being said, how can we help? First, it is important to be aware of the warning signs of alcohol misuse. These can be categorized into topics of physical, behavioral, cognitive, and psychological signs, as well as just being unable to control the use. One fairly simple and quick way to determine if someone might have an alcohol use issue is through the CAGE questionnaire. It consists of 4 questions, and saying yes to 2 or more questions may indicate an alcohol use issue. If you or someone you know displays the warning signs of alcohol misuse or answered yes to 2 or more of the previous questions, these resources may be of assistance. The first being a primary care doctor. Primary care doctors can provide local resources as well as referrals to mental health and/or substance use specialists. There are also a variety of hotlines and websites, and for those in a mental health crisis situation, the National Suicide Prevention Lifeline. With that being said, thank you for joining me today. These are the references for the outside information that was provided. I hope you have learned about alcohol use among Illinois farmers, as well as how to spot the signs of alcohol misuse and where to direct someone who needs help. Thank you.